Fambulem, we are live. Thank God we are live, and this is Psycho John Barry. This is the then and now media empire. Today we guest. Today with we, but he can't introduce himself soon. But before he do that, and we just want for tell una say for share the links to as many people as una come. This is the then and now. Stay tuned and stay connected. Okay, Fambulen, this na the then and now media empire. We get to guest. Introduce yourself, sir.
Mina Abdul Jalo, Mina a psychiatrist, then Mina a global mental health expert, also a lecturer at the University of Sierra Leone, College of Medicine and Allied Health Sciences.
Okay,
And
okay, go on.
and they head the Psychiatric Hospital, also a board member of the National Drug Law Enforcement Agency, the NDLA. Yep.
Okay, thank you so much. Fambulem una the watch. Dr. Abdul Jallo, na the manager for the psychiatric hospital in Sierra Leone, teaching hospital because I see something like a teaching hospital. Yeah,
Absolutely.
yeah. So we'll go on for let you tell me a bit about yourself. Let you go deeper, like just telling us about your educational background.
Wow. It's a long set. Okay. So bring to speed. Yeah, I attend the Prince of Wales. Now in the last batch we sit the advanced level, the A level, and then I come College of Medicine and done. But during me undergraduate training at the College of Medicine, fourth year, now make up my mind for choose psychiatry as my specialty, and as a result of that, I be invest in myself heavily with support of family members. And how it starts, we will go Kisi because fourth year we can go Kisi for a 2 weeks rotation. By then, I'll be Dr. Naim. That was 2006, yeah. We go there, I see the condition of the hospital, very dilapidated, ramshackle, very filthy, patient being chained, no medication. The place was like a prison. It was really bad. So I came back, slept over it. I was so discouraged. But I said, wow, how can a whole hospital this so, and mental health na a very serious thing, and then only one person. So now I think they become me a person we very emotional sometimes. I know for suicide people they suffer. So now no, I think yeah, because I want to do ups and guy
Okay.
yeah, no, I think say I go choose psychiatry. So my colleagues in a class, my classmate by then, the facing a phone I they get, they begin to laugh me. They say, "Hey, you sure say you want to do this thing?" I say, "Yeah, I want to do them." Say, "Okay." The 50 year, luckily some team come Sierra Leone from UK. They call it the Barnett and Harrigan NHS Trust. Yeah. Dr. Rose Folong, Denny, and others. They can come every year for do some time for spend some time with me. And of course, I approach them, say I get interested in psychiatry. They say, okay, wow. Then 50 year, we pass go 50 year. Then 50 year, we can go electives placement. So I choose psychiatry as my placement. I go UK, and by then I go na Wales. We spend like 6 weeks now the Princess of Wales Hospital.
Mhm.
I rotate through different units: child and adolescent psychiatry, substance abuse, forensic, you name it, adult. I rotate throughout. As I say, the way how we interpret
Perceive am.
psychiatry
Mhm.
now as Sierra Leone is different from Obayanda. And I say
Mhm.
no, no, no. So my interest increased more and more. I come back, so I make sure say every year where I go vacation in UK, I must attach myself na a psych unit. So I rotate na almost almost all the psych hospitals in London. Yeah, Mosley, Lewisham, St. George's, Bethlehem, St. Anne's, St. Pancras, almost all. I make sure say I do observership, all of them, and even with community also I do. I build a strong network of mental health professionals today. We are still in contact with them, and they still be my mentors. So then fast forward, I done medical school, and after my housemanship, I go Ministry of Health. I say, please, can you guys post me to the psych hospital? They say, why? Because this never happened. Why you want to go there? As I say, because na my passion, na my interest, and I want to pursue. So they post me there. I work there like for 2 years, and that really helped me. It really helped me. It opened my eyes. Yeah. So after me work there for 2 years, I go one conference na South Africa, Global Mental Health Conference. So as meet say one Kenyan professor in psychiatry, would they talk me nice, and Nala tell us say I'm interested in psychiatry. I say, but we not get this type of training in our country. I say good. I say, did, have my card, email me your documents, and I will take it from there. Then now so things happen. I go Kenya without paying a dime for my application. Now the professor I pay for me everything. Then threw me back. My colleagues also follow suit. About with 5 or 6 we go Kenya that particular year. Ophthalmology, gynae, internal medicine, pediatrics, surgeons, we all go. Then during my training also in Kenya, I exposed a lot. I traveled in so many countries because the professors that they really encourage me, they expose me to the international world of best practice. So I travel a lot, attend conferences, workshops, do presentations, and then I spend like 2 months placement na Slam. 2 months also. I've been at King's College and Slam, rotate now all Islam hospitals there. I done 2016. As I done immediately, I come back to Sierra Leone, and they post me at the hospital 2017. I be do work there. So now they are the big thing starts. How for change the hospital, how for transform the hospital, how for change the narrative of mental health na salon. And thank God, I go there, and that's the work I work at the hospital really helped me that 2 years there, because the
Mhm.
staff they really respect me. They really know say this man, that person where gets passion for this thing. So when I come back, it was easy for me for make them buy into my ideas. So I tell us say we get for work as a team, because teamwork is very important. And one thing what I can always tell the young guys, the young doctors, they say, no matter what you they do, you always think about the future.
Mhm.
Your integrity, that's for be paramount in anything way they do. So because of my integrity, these guys really respect me. We work as a team. But I will find ways and means how for change this mental hospital practically, but no way not be there. The government not be prioritize mental health by then.
Okay.
Yeah, then thank God, I get a senior colleague where they work with partners in health. So a team of their partners they are come na Freetown. They kind of Freetown. So among them there be a clinical psychologist, the partners. So he say he want go see the hospital. Wow, I think I just open everything for me. Where they come, I take them, I get a history of the hospital, I take them around the hospital, and they see things for themselves. And that really shocked them, that really touched them. And after the tour of the hospital, they asked me how are they manage at this age with this type of condition at the hospital, and they be really touched. They really touch. So when I go back, so Dr. Barry, when I'm at the head of the PH now in country, they call me. I say, Dr. Jalo, the story we give people, it touched them. And I think they are interested in what you are doing in the hospital. I say, okay, good. Then I think they reach out to the mental health director now, Boston, and Beppy email me, say he go and get a Zoom chat with me for see how a PIS could come on board for help. Of course, we get lot of meetings because for starting something you have to plan well. So we plan short, medium, and long term. The short term now for the hygiene of the hospital, medication, and for stop chaining of patients. So by September 2018, 3rd of September 2018, now we get this symbolic ceremony at the hospital where the then Minister of Health, Dr. Professor Alpha, will go and stop changing of patient at the hospital. And up to date, changing not happen again at the hospital, and
Okay,
it will never
okay,
happen again.
Doctor, I hold you there first. You know, you story because I read about you a bit. I see all what you talk, so especially your educational background and then thing in there. But we see, okay, now I think the time we've been going to hospital, Doctor Naim been there, right?
No, we all retire. Now
Okay,
be after Dr. Naim, we get told that Dr. George will die during the Ebola, but not to psychiatrist there.
okay,
After Dr. George, now they send Dr. Mwana in back
mhm,
not to a psychiatrist.
okay,
Yes, but Dr. Naim be they go there as a consultant, but not to
okay.
him be the head there again.
Yeah, because the like what you they do so like what you they tell you inspirational because we see where you get a passion now passion and drive you because you like and you want help people them now you decide for specialize in that area but you they see the attitude of sometimes the attitude of Sierra Leoneans them especially people the way they work in a certain institutions them like when they see a young man like you come and then you get that passion some man go want for fate you and then thing in the you been facing challenges then they
Those ones they are inevitable. They
okay
happen. So, that happen. But how you able to navigate through those challenges?
okay
Yeah. It happens. Even so somebody I ask some journalists they all for blackmail me all and all those things. But it's part of the job. Yeah.
okay
One thing, just like I say, your integrity. You for always try for maintenance.
Okay.
Yeah.
Yeah, thank you so much. I just want to remind Fambul them. We don't get people them way already. So man, the watch with live from Falaba district, down Mongo Bendugu. So let you know, say people in the watch you all over the world. And then Dr. Jalo, now you say you will not go till you stop usai, you say una be stop for chain people them we get we know well where they go today. So how now they manage them violent people them like because you know say some we get mental health, they beat, how now been they manage that now? What you now been put in place?
Yeah, what we do for that short time there, we
Mhm.
get what to call sorry, we get what to call soft restraint. We
Okay.
wanna so some paddle for putting na the leg there, but that's even you know the okay. So so we create a comfort room like for a violent cases there, but through the help of medication because with more we depend on the chemical chemical restraint now
Mhm.
we depend on chemical
Okay.
give them medication and talk to them. Thank God the hospital be okay now where this coach don't come now we get a lot of violent issues there, but it's okay, no not changing again. Yeah, and we dey take the message down to the communities, down to the herbalist. Yeah, so
Okay,
it's it,
so we see again like you say na this coach, we get for come to that. So which type of mental health issues we get? Because we dey see, for example, now like some man just the vex. We see recently where somebody he end up for loss in life, he go take gun he, from policeman, then soldier man end up for firearm. And then you dey see even na social media, some man just the boss, he dey begin cause mami cause, he dey you know all them thing in there. Some of us we can feel saying a mental health issue, and we really say mental health don't increase so much so that the government won't pay attention because we already the vice president they talk about that. So tell me how what in the mental health rate in the country?
yeah. To start with, mental health is the same everywhere you go. That the same conditions that we in the UK, not the same conditions that in there. Then, if you consider waiting we don't undergo as a nation, the war,
Mm-hmm.
the mudslide, Ebola, that fire disaster, the flooding where they happen every year, coupled with now the global economic crisis,
So
poverty,
poverty.
yes,
Mm-hmm.
unemployment, all those things. If you don't say mental health issues, it don't it dey rise exponentially, and now the COVID. So the only unfortunate thing now, Sierra Leone, is we will not do any research for sure exactly how the prevalence of their mental health conditions they are. But now the hospital records they show say there are a lot of people really undergo mental health challenges. Lots of people, lot of people, lot of people. But the good thing is people are now don't they come out for speak, for talk, for
Okay.
seek help. Yes, and family members now they help their relatives there. So that's don't really help. And the visits of the president now the hospital in 2020 really trigger people for going to the hospital. So now we get over 4,000 cases, over 4,000 cases we on outpatients. I'll just check the records. We go over 13,000 from 2018 to date. Over to 13,000 people. Over that was up to June July. Over 13,000. So we get different cases along the spectrum. We get the psychotic cases there. We get the neurotic cases there, the personality disorders there, the substance abuse. We get bipolar.
So
Um,
explain
uh,
to me, but explain to family them that psychotic case, and then what are the difference, so that maybe some man get them, but you not really know say he get mental health issue. I want
yeah,
follow you go deeper a bit so that people don't understand. Sometimes from tomorrow you go see some man go begin go to you say, well, that way being explained will get them more.
yeah, and that's now we wish because what make people they come out. What you mean by psychosis? For the layman, now a person they get some things there. For example, you will hear voices
Mm-hmm.
where the other person not the hear, or see things there where the other person they see, we call hallucinations. It affects the five senses: touch, smell, taste, see, hearing. Then we get what we call delusions. Delusions now fixed false belief, way contrary to the person in educational background and in cultural background. For example, this person go say, ah, this person dey after me. This person he want harm me, he want kill me. This person he go really say in a God in Pekin,
Mm-hmm.
in see God, in a so in get special powers, in go make things happen. Then back you go see this person go say it organs then nine body do rotten. You go see this person they feel guilt of things where something he don't do over many years ago. They feel guilt. He see back this person, he dey claim say he and this person that they in relationship. So all let's see that they now we call delusions, the grandiosity, the persecutory, the paranoid, the guilt, the the back the one back will come on again, especially among the alcoholics who call morbid jealousy, where this person the jealous in partner as if a partner come out self, he go so tell a come out work he come that person they go to the bathroom, he go begin accuse her say, you know, come out see man or woman, and like a very violent or aggressive beats the partner. Now that we call morbid jealousy or yeah. Let's say they come on they back they see some they behave bizarrely. Things that we may you know they do normally nine day that they do. You go see this person, you go they come on they waka, they go far when I come on now this part of the world. And na low income countries there. You go waka like from here, take go Kabbalah. Yes. Then you go see this person, they wear dirty clothes, check clothes, and he not care, he not know, he not know. So now you get behavioral issues, they get emotional issues. You go see this person after they don't vex, the irritability they come in. So the psychosis, this psychotic disorders there, you get hallucinations, delusions, you get behavioral issues, you get also speech problem also. You go see this person, you go ask a question for make it tell you the answer, he go deviate totally. Then some now he go see the jump from one topic to another. Then some he go beat around the bush before they come to the answer. Those are the psychotic symptoms there. Then you get the neurotic disorders there, when are the depression and anxiety. I can always say depression and anxiety now like 5 and 6. Now they're waka.
Mm-hmm.
Most of the symptoms are related to anxiety, also they in depression. The only difference with the depression is the person they get very sad mode, sad, low mode. Then they lost interest in things that way they don't use for do before. For example, if this person don't use for go work, this person will just stop for work. Or if this person don't use for go play ball, he go just stop for go na farm. He go just stop totally. I like you talk to her. He go say, I'm not interested. Then now, those are the two signs in depression: low mood and loss of interest. Then I get the vegetative symptoms there. We get loss of appetite. That two type where depression they happen.
Mm-hmm.
Some it increase the appetite, then some it decrease the appetite. Some it make them sleep too much, then some it make them not sleep at all. So all those things. for anxiety now, you go begin this person go say they worry, they fear, they become apprehensive, restless, he have to go the beat pan and like say one come out. So all those things. Yeah.
Okay, thank you so much. Fambul them. This na the then and now media empire. We can always bring to una issues them about where they happen back home, not always about politics. You know, say the then and now media platform, na a professional platform where we get lot of things them in our bag. So we dey bring issues them to una. This today we get Dr. Abdul Jallo, where na the manager for the psychiatric teaching hospital in Sierra Leone. They tell we about mental health issues and other issues them now country. Dr. Jallo, who's one prevalent now country?
Just like I say,
Mhm.
we not do a study it
Okay,
for
for now.
for sure one day. Yeah.
Okay. Okay,
Yeah.
so yeah, so like again, how una dey work with the government? Because we already say the vice president they had some for do something regarding the mental health issues. So you are aware about that una dey work together, you and the ministry?
Yeah, me na ministry staff. So, and I mean the government psychiatrist. So, and I mean the only person when a local, when a national psychiatrist. So, of course, aware of the task force.
Okay.
Yeah.
Okay. So again, we see recently the outburst, if you want you call under way of this Kush business in the country. How this don't affect with society?
Hugely, hugely. This coach business not when I start. Oh,
Okay.
it don't start long time ago. Long time ago. It's just that it don't increase exponentially. They don't increase greatly this past 3 years.
So what you make it increase?
Maybe the supply chain, yeah, the supply increase, so maybe another make it increase. Yeah, but several factors come into play. Yeah.
Okay.
So back one thing about drugs business.
Mhm.
Now the West African region, not to animal. Yeah, because the focal point for ECOWAS for substance misuse na salon. So I can attend meetings there. Yeah, this issue of drug issue not to animal. Na big issue na the sub region. Yeah.
Okay.
So
So what you
and
Mhm.
considering the porosity of we borders,
Mhm.
the but currently waiting with the notices, the kush way that they use na locally made one.
Okay.
Yeah, the exports don't decrease, hugely, but now a locally made one. What they use any kind chemical, formalin, that they use a diamond bone, they use a nail polisher, what the one that they use. So many things there. Use any kind of leaf and mix them. So use them. Some can even add them tramadol. They get the Jagaban type. The don't get the tramadol one.
So one day we name Jagavan.
Yeah. The Jagaban ain't the bad ones in fact.
Okay.
Ain't they get that's so food. Now they make the when it becomes swell. Yeah, and they kill it. In fact, they kill it.
So what in you don't do in terms of that for like when I say you now you as the head now that psychiatric hospital, what you una don't do with government, what you una don't do for tackle that?
Well, the president be I think in a cabinet meeting, he be direct the chief minister
Mm.
for call an emergency meeting of stakeholders there. Where from there they don't establish inter ministerial. a task force for looking into this issue of drugs. So as a result of that, the Minister of Internal Affairs and Social Welfare now they're the lead because then they then take this thing more of a social and security issue.
Mhm.
So um so the NEPA creates what they call holding centers because most of the guys they were in a prison now as a result of this kush substance. So those guys should be taken as victims, but not as criminals.
Mhm.
So they want to see how they create avenues for make the carry the day. We assess them who that fit for go into a rehab. Then will go transfer it to the rehab center. Currently, we the EPA try for do the final touches in the rehab center we'll get at the hospital and Ministry of Social Welfare they don't come on board. So by the end of this month, hopefully by God in power, inshallah, we will commissioner and one. Two, before this coach business they come up, we be done think ahead. We don't train we dey train addiction specialists there on the Colombo plan. We're in a US based universal treatment curriculum
Mhm.
for trained addiction specialists there. About 27 in different sectors, and they don't done the three phases. Now just one phase left, one module where they will soon done because nice support from ECOWAS. Yeah, they don't also we don't train we don't train core drug educators. These are people where they raise awareness, where they sensitize the community about drug issues. We don't train lot of them, and they nationwide. Then that is part of the for increase the human resource the workforce. Then also we don't thank God we don't able certify the hospital as a teaching hospital. Yes, so now we train we own mental health professionals, psychiatrists locally. As at the talk now, we get about 8 young doctors there. We don't opt for do psychiatry. We will even start the the training. So things happen. One thing about mental health for the past it has been neglected, not only Sierra Leone but
Mhm.
globally. So now in fact where the world they take a huge step towards this mental health. Thank God because of COVID, because COVID bring a lot of mental health issues to light.
Mhm. Okay, thank you so much. Fambul dem una di watch Dr. Abdul Jallo. This na the manager na the psychiatric teaching hospital na Sierra Leone. We dey talk about mental health issues we prevalent now country. Dr. Jallo, you talk about say you na record about 4,000 people them we get mental health issues for the
More
past
than
more,
more
more,
than
more than that. So would una keep them or how una they deal with that then at the hospital there or who side then?
well, this is the interesting thing. Before
Mm-hmm.
we used to forget Boku inpatient,
Mm-hmm.
but now we get Boku outpatient. If you go to the hospital on Wednesdays,
Mm-hmm.
we see over 150 outpatient on Wednesday, over 150 patients. So now we don't get a lot of outpatients. We're very good for we.
Mm-hmm.
We're very good for sure. Say yes, people that they access the services and they appreciate the kind of services where we render to them. So it's very good. We get lots of follow-up cases, lots of follow-up cases. So What to one do now? One go into the community psychiatry, because most of the most of their cases they are the day na the community. So now the more we they try for do and for update the national mental health policy and plan. We therefore be a multi-secretarial, a holistic, integrated, and culturally sensitive, then community-based approach. Yeah.
Okay, thank you so much. What you una can give them people that una get tablets, they una they give them, una they prescribe for make them go na pharmacy and buy for them. Say how una they operate.
Well, we they use the biopsychosocial model of care,
Okay.
medication, psychotherapy, then social services. So for the medication, there, of course, thank God, we get PIH, where they really support with the psychotropic medications there. We get from first generation to second generation antipsychotics. Yeah, we get the olanzapine, risperidone, quetiapine, they'll get the antidepressants, the SSRIs, the SNRIs. Yeah, so we get medication there. The other challenge is now when we can get, when we maybe we go into low stock. Now we can ask patient for go buy na pharmacy, and that is all a good thing again. The pharmacies they also they count their medication there now, although they're expensive, but psychotropic medications are not cheap anywhere in the world. They are very expensive.
So make I ask again, maybe I believe say in other countries, government they can inside for if especially mental health issues, now then they provide medication for this. So in Sierra Leone, now the patient then now then they go buy, now then they buy, now then family they buy, or government they supply them with drugs.
No, all services that the hospital are free of cost.
Okay.
Are free of cost. Now, now when we not get the type of medication where you need,
Mm-hmm.
now we'll tell you say now for go buy. But again, the mental health not a part of the free health care.
Okay.
So government maybe just create these things, say yes, for make for increase accessibility and affordability.
Mm-hmm.
So make the service they are free of cost. Yeah, and the NGO back the way they supply the medications there now free of cost to every patient we're going at the hospital. The services at the hospital are free. We feed them 3 times a day, free. They clothe them free. Everything are free for now.
Okay. Okay. Thank you so much, Dr. Jalo. Again, I still want to remind Fambul them say in the watch the then and now media empire. Today we deal with Dr. Jalo, the manager for the psychiatric teaching hospital na Sierra Leone. Dr. Jallo, again you mentioned because recently we don't see where they hold some people them way with Kush, way not to the dealers them. I'm talking about those who consume it. Like you already said, some of them then go then a prison or then they in remand. So una can go treat then they then na prison day or then just they send them no more left them with their own problem day.
It depends. You know, say addiction.
Mm-hmm.
Some not need medication per se. Now
Okay.
just for go through the program, the rehab. In in the if that person they develop psychosis,
Mm-hmm.
we will call drug induced psychosis or psychotic disorder.
Mm-hmm.
Now we they treat that person. We go to call detox. We could detox you.
Mm-hmm.
Then now after that, now you go through the rehab. But currently, we go through the number of outpatient we doing. So what thing that they do is they carry the patient there or with the accused now the hospital. then we can assess them in the hospital and advise the way forward.
Okay, thank you so much. Again, this thing don't look it look rampant, but the hospital now how now they manage this over 4,000? Is it Freetown no more or na the whole country? Again, that now one. The other question is now whose part na the country get more mental health issues?
Yeah, say the mental health care delivery in Sierra Leone is
Mhm,
top heavy. Okay, it's more based in Freetown,
mhm.
which is centralized, and in Awangwe Hospital. And people if you say mental health issue now just Ministry of Health issue, but we receive cases all over Sierra Leone and even from Guinea and Liberia.
Okay,
We will, yes, we receive cases there. So for pinpoint say now this district more they get no. What we know is the referrals the way they come to the hospital, they are more from family members and from urban. Yes, but we receive all over the country.
okay. Thank you so much, Dr. Jallo. And also, first time like who have been the Freetown. I don't know whether it's still the like you dey see Boku people well then they call them Chris Man and then in a street and then how una can hold and then go to the hospital una go treat them or una the way till they refer them family refer them to the hospital.
Well, that that only for be the work of the councils.
Okay.
Yeah, yeah. We own role as mental health professionals. For me, as a psychiatrist,
Mm-hmm.
na foka with the person,
Mm-hmm.
assess her and plan the way forward. But me not to go a street for go take patient
Yes,
a
so
street.
una don't ever engage with the council don't ever approach you now and then any council in the country don't approach you now for see how best una they address the issue then they.
Well, this is the essence of this task force.
Mhm.
Hopefully,
Okay.
for see how they will work. Yeah.
Okay. Thank you so much, Dr. Jallo. We'll not get much time again, but we still get few questions them. We talk about just now. You talk about the rehab. Say una then get for commissioner soon, not so.
Yes, yes. By
Okay.
voting power.
Yeah, so I be know like before now, like you be they say first time them in the chain people and the now them in the call the Christian before now. Them in the chain people then get something like a big parlor or something. So we they see like for example like UK now, yeah, like you already know, maybe you know past me in that area there then get people the way they can take care of dandy them. So how you get enough staff where they deal with them people and then a net on a day during the daytime where they take care of them people and they.
Yeah, just like how it starts, the issue
Mm-hmm.
of manpower.
Okay.
Manpower is a big challenge. Yeah, so the staff they're not enough, of course, but we they manage with the one that we get. Yeah, but really not easy. Yeah.
Okay. So the let's say the gate one I don't know whether wanna get a gate like so now the lock for later not come out because if some come out maybe then they abscond or some man they go cause violence. How una can do that?
Um, a teacher self knows say a hospital not to prison.
Mm-hmm.
So a patient we stable
Mm-hmm.
get the right for move around. So they like move around. Now just one way where we know say na a risk to himself,
Mm-hmm.
na risk to others and others to am.
Mm-hmm.
So now that kind of way we can somehow um, put things in place for make them not go out. Yeah, but to get security, but it's no if in UK, I believe UK now hospital we one patient abscond
Okay.
from the hospital. Yes, yes, it happen any side of the world.
Mhm.
Yeah, then for when I am the skill defense. the jump that higher fence there. Yes.
Mhm.
Especially the addicts where that craving they
Yeah,
come.
we don't. Mhm.
Yeah. So now they're mocking jump. They don't pull part of the hospital, the ceiling. They don't pull every day, every day we they make. Every day we they make. Every day we they make. They pull. And most of these guys they get antisocial personality disorders. So it's a challenge. But we are doing our best for see how we go able help more people.
Okay, we dey see also people like dem can associate that with poverty and stress, but some man can get wama too much. Like you been don say na one of the signs wey some man anyhow thing e don outburst, e dey cause, e dey misbehave, like e dey go beyond the normal way of misbehaving. So how dem kind people dem dey, whose advice you go get for dem kind mortal man dem dey?
And they foresee a mental health professional for make they able assess them for determine if na anger, yeah, or if na or if they get an underlying mental health problem because outburst it can be a sign of a mental illness. So yeah, but again, me not just take one symptom
Mhm.
for classify somebody say again mental problem.
Okay.
So yes, now that we could get what we could call diagnostic criteria where would they use for make we come into conclusion say this person get a mental issue. But my social media or person they be misbehaving on street, I can't say unless you come maybe see that because we will depend more on history taking
Okay.
history taking and the mental state examination. You come with Sidor, we talk, then are able for assess you more. But but a single symptom or sign, enough for say this person gets that problem.
Okay, so that lead me for ask you. So now, how many signs then the person forget before that amount to mental issue?
It depends on the mental health condition
Mm-hmm.
where the person gets. It depends, and we diagnostic criteria that we they use dynamic. If you see say this person in behavior
Mm-hmm.
don't change from how it used to be,
Mm-hmm.
now for help that person they foresee a mental health professional. Now we no more able, now we no more get the legal authority for say yes, this person gets a mental health condition, but no other person no gets that legal authority there. So the best thing now for help the person for carry time for make we able assess them. We get what to look for. Yeah, but for this program, I not able talk because it depend on the condition where the person gets.
Okay. Yeah, fumble them again. Like una, especially una with the salon, we dey encourage una all anybody like una get them kind similar cases like how Dr. Jalo explain, una go to them, una we dey encourage una for go. They Dr. Jallo don't transform, because I read a lot of so many articles about the way you don't transform the hospital. So Dr. Jallo, before we go, if you dey struggle a bit with staff, how you dey cope with funding for run the place?
Mental health financing are a big challenge.
Mm-hmm.
Not only winner, yeah, but for low and middle income countries,
Mm-hmm.
most of the budget line for mental health is less than 1% of the
Mm-hmm.
total national budget.
Mm-hmm.
And before we not be get a budget line now the Ministry of Health, but now we get but a limited, very small, very small. So now waiting more we depend on now on donors, partners. Yeah. We just hope say this task force go able um, um, create the opportunity there for make mental health is being prioritized and invest more into mental health.
Okay, but Dr. Jallo, if because we know say recently, like even when the president go visit the, and then we know the concern, like this Kush business come, like people them really alarmed at the rate at which way almost people in the sleep any corner where you go, you meet somebody snap in the sleep. So with that, una don't engage like the government for say, okay, una need for lay them add the budgetary support so that una go able run effectively well.
Yeah, yeah, yeah. They are aware. Yeah.
Okay, so in fact, this platform again, we dey use this opportunity for appeal to government through the Ministry of Health. Recently, Sef have been get Doctor Professor Charles Senesina ya na this program ya. We interview am on some different issues them we e been done dey do, but we want for use this opportunity for appeal to government for let dem increase support for una so that una go able tackle this mental problem. So wetin before you go, wetin you get for advice Sierra Leoneans them, especially drug addicts and generally Sierra Leoneans them as a whole?
Yeah, I can I go start with the drug issue. Um, addiction, nothing we person none of even start. You start them for make you left them a difficult, and no medication all day for make you left them. So you just need to forget the willpower, determination for say yes, are they left this drug. There is there are symptoms really get, and it not go kill you. It just gonna make you become discomfort. But just beer. If you beer 1 tier, 2 tier, 3 10, you go for overcomer. So please not start for take kush. Kush is deadly. Kush they kill. Kush they cause different damage in your system, your heart, your lungs, your kidney, your liver. Oh, when I say they see how their body they can present, they sweat well, they get so food. So kush not good. Kush they make you deteriorate. They bring you backward. If you're a student, wait for don't go 1 step ahead, you take kush or drug, they bring you 10 step backward. So now for avoid kush. Kush they make you get HIV. Drugs they make you get HIV, hepatitis. It lead to death. So please make we stop this drug issue. Now for the other mental health conditions there, please make we all be each other keepers. You neighbor, if you see say this neighbor able to come out every morning for go work, now you see he just dey inside your house, they come out. Please now for help am for seek help, no begin for laugh am, no provoke am, help am. Mental health or mental health conditions, it affect anybody at any time of your life, from below man up to begin the youth, adults, the elderly, they affect you at any time throughout your lifespan. So, not say because you not got it today, you know you got it tomorrow. Because just small thing can switch you over. So please make we help we self, make we encourage we self for seek help. Make these hospitals be with first point of contact before ever we take we fambule to the traditional healers. The traditional healers, yes, themselves can help because we are all partners in this fight. So please make we learn for be we borders keepers, make we left for the gossip people we get mental health conditions. It can affect anybody at any time. This year World Mental Health celebration, they talk about human rights as a universal thing. People with mental health conditions also get the human rights way for be protected and respected and promoted. So please don't abuse this person because he gets a mental health issue. You begin to chain him, you begin for discriminator or for their names for stigmatizer. Those things that all they prevent people there for come out for talk about their conditions. So please make we stop the discrimination, the stigmatization of people who get mental health condition. Thank you.
Okay, thank you so much. Let's give them one bonus. If things continue for be like how it is as now, how you feel say Sierra Leone get for day?
And continue for be how will they improve? You mean?
Yeah,
Or
no, waiting because una they get a lot of cases them like
yeah,
undetected mental health issues then in the country. So
yeah.
if government not let's say like government not serious for come now just talk or like people they know how you feel say how what you dey foresee in the future in terms of mental health na salo.
It could be the disaster because mental health implications they're huge in terms of economy wise, in terms of education, in terms of security, in terms of everything. It's huge. And if you watch the cost to the economy of mental health globally, it's huge, over billions of US dollars. Over, I think now it's like trillions of US dollars. So it's huge. So mental health it affects any facet of the society. It has to be taken seriously and 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 therefore invest into mental health. If not, the future it will be difficult.
Okay, so before we go, somebody just send message. He say, "What have you done with the hospital to be screening for mental health disorders? For mental disorders."
I don't explain that one. I say you get the doctors there.
Mhm.
Now with 3 days when a psychiatrist, we'll get two from Nigeria, myself, they'll get 8 resident psychiatrists there. Yeah, we access or screen like any other part of the world or any other hospital.
And that's not free.
Not free, of course. Yes, free.
Oh, okay, family. Now, so we dey end the program. This na Dr. Abdul Jalo, na the manager for the psychiatric teaching hospital na Sierra Leone. Thank you very much for joining this program, and we go hopefully we go call you back one day for make we talk. Thank you so much. We do appreciate you.
You're welcome. And thank you too for this opportunity for tell people exactly waiting will they do, waiting our next plan.
Okay,
Thank you.
thank you so much. Family them na so we dey end the program. This na Psycho John Barry, and then until then, I say goodbye.